Hello, welcome to Native Yoga Center. My name is Todd McLaughlin, and today I am presenting yoga for back pain, yoga for beginners, specifically low back pain. So if you have stenosis, spondylolisthesis, herniations, any sort of, maybe you just have like tight musculature, this video is for you. And please remember to subscribe, like, comment, and I will respond. All right, so what you'll need today is your yoga mat, and you can, if you have yoga blocks, grab some blocks. It's not essential, but I'll point out a few things you can do with the blocks. And also, if you'd like to use a blanket or a bolster, I'll implement different ways that you can bring them into your practice. All right, so first what I'd like for you to do is come into a reclining position on your back. Stretch your legs out, lie down on your back, and relax your arms completely. Bring your legs together. Take a deep or closer together. Take a deep breath in through your nose. Fill your lungs and let your belly push up on your inhale. And exhale, breathe. Allow your belly to drop. Now, the first thing I want you to discover, how does your back feel when you're laying flat? You might need to bend your knees and lean your knees in with each other. So there's like light pressure. And this slight bend or this bend in the knees will change the angle of movement at your pelvis and your low back. So I just want you to first discover, are you in pain when you lay flat? And does bending your knees take away some of that discomfort? Okay, and so when you figure this out, now you might still feel a little bit of pain or discomfort while you're laying down, but we're just getting started. So we'll first just try to find the position with the least amount of pain. Okay, now bring your right knee towards your chest, grab, interlace your 10 fingers, release your left leg down, and pull the right knee downward towards your right shoulder gently. Don't force it. You can always back off. I want you to pay very close attention to the sensation that you have in your back and in your hip, and try to ease in the pressure as you work toward the discomfort. Now, you might find this alleviates any discomfort that you're having, and that this would be wonderful. This is what we'll hope for. Now, as you pull or draw the knee down toward your body, if it increases the discomfort, I would like for you to take the knee further away. And now just take your chin, drop it down towards your chest, and breathe in and out through your nose. Try to control the rate and speed of your breath and the rhythm. So when you breathe in through your nose, fill the lungs. And as you exhale, breathe out of the nose, empty all of the air out. And we're going to release and lower your right leg all the way down to the floor and bring your left leg up. Or you can start with this knee bent. Grab a hold of the knee. Try to lower the right leg all the way down. Pull your left knee down towards your left shoulder and use the strength of your arms to create the compression of the thigh bone on the belly. This massages the descending colon on the left side. The right side is the ascending colon. And you try to compress or press the thigh bone strong into the left side body. Now remember, gauge the pressure, go slow, focus on your breath, breathe through your nose, tuck your chin down towards your throat. And as you draw the knee downward towards your left shoulder, just alleviate or release tension and stress in the muscles of your hip and low back. And breathe through the nose with a nice, easy, steady rhythm. Very good. Okay, now release and lower your left leg down and bend both of your knees. Now lift one foot, grab the knee, lift the other foot, grab the knee, and try to bring the knees towards your chest, and then release and let your knees come away from your chest. Bend your elbows, bring your knees in towards your chest. Straighten your arms, take your knees away from the chest. And what we're doing here is when you notice when you pull your knees in, your low back is going flat down on the floor and stretch the muscle in the back and the hips. And as you release, it changes the angle of tilt at the pelvis, and the lumbar curve, the natural curve, increases again. And so we're just moving the pelvis forward and back to help stretch and release tension in the lower back. Okay, now let go and let your feet land on the floor. Relax your arms on the floor. Lean both knees over to the right. Try to just relax into your hips and just allow the weight of the knees to do the stretching for you. And I want you to pay close attention to how much pressure it might apply onto your back. What you can do is you can always put a bolster over on one side or the other. I can even make the bolster a little higher if it was to cause a challenge. Another way that you could do is you could put a bolster in between the knees, and you can let the knee rest on top of the pillow, and you can even take your leg and extend it all the way out over to the side, and you can stretch into this left side hip. So work just as far into the stretch as feels comfortable. And remember, the beginning level version is to just let your knees simply hang and relax. Gravity does the work. Okay, let's switch sides. Bring your both knees up. Tip your knees to the left. Turn your head to the right. And do the same thing over on this side that you did over on the right. Allow the weight of the body and gravity to do the work for you. And relax into the muscles surrounding your hip. You're going to feel a very gentle twist in your lower back. Remember to breathe. Inhale through your nose and exhale out through your nose, and just try to relax the body as much as you can to help gently stretch in these different ranges of motion for your hips and lower back. Okay, now come back up, and what we're going to do is we're going to roll onto our right side body. So you take your arm above your head, roll over onto the right, and create a side laying position where you just use your arm as a pillow and allow your head to relax onto your arm. Okay, now use your core, engage your belly, place your hand on the floor, and gently come up and slowly make your way around onto your hands and your knees. Now we're going to utilize what's called cat and cow pose. And this is a place where you can, if you like to use blocks, you can employ blocks. Now, I don't suspect you're going to have a hard time having your hands on the floor, but for some of us, it might be challenging to do that. In which case you can put something under your hands to make it more easier for you to have the body weight forward. And another option too is sometimes the knees feel bony, and you can take a blanket or any type of cushiony material, and you can always place it underneath your knees to give you a little bit of padding. All right, so align your hands underneath your shoulders and your knees underneath your hips, and work into the cow pose, where you lift your chin and roll the eyes and look up, and work into the cat pose, where you press down, let your head drop down and round your spine. When you go into cow pose, you can move a little like an upward dog, where you lean the weight forward to your hands and look up. And when you go into the cat pose, you lean back and press strong and stretch your back. Now, I'd like for you to feel when you go into the cow, does your back feel okay in the back bend? And when you go into the cat, I want you to feel your back and just notice, how does it feel in the rounding? Does one direction, try the cow again, does one direction feel better in relation to releasing tension or pressure off your back? When you go to cat pose, investigate the same. You might find that you're a little more comfortable in flexion, or you might find you're a little more comfortable in extension. Or we might need to work a little more. Watch what I do here. I have my back nice and straight. I'm not really going into the cow. I'm not really going deep in the cat. And I'm just creating a very slight oscillation motion up and down with the spine, and not really going as deep as I possibly can. And this motion is really important, because if you can learn how to slow the movement and go very, not go to your edge, stay far away from your edge and just make subtle movement, this can have a profound effect. Okay, next step, I'm going to have you come into a lunge position. So I put blocks here under my hands to make it, should demonstrate how it can be done easier. And bring one foot forward so you're on your left knee and your right foot, and walk your right foot a little more forward, and then lean the pressure on your hands and lunge into the bend of the knee. And what we're doing here is we're creating a deep stretch in the hip, which will loosen the muscles of the posterior hip and around your low back, and also is lengthening and opening the psoas muscle on the front left leg and the quadriceps on the front left leg. And so in doing this, we're creating a kind of yin-yang effect of flexion on the right hip, extension on the left, and then we'll switch in a moment. And this way we're accessing opening the muscles that are involved in walking, such as your psoas muscle, stair climbing, and also any other activities that you're exercising with. We're going to try to create an even, balanced, counter stretching effect. Let's work on the other leg now. Take the pressure off, bring one leg back, take the other leg forward. Remember, the blocks are totally optional. If you can touch the floor with your hands, you can just have your hands on the floor. Walk your left foot just a little bit forward and create a lunge into the left leg and stretch open now the right psoas and the right quad on the right side, and release the left side hamstrings, left hip, and lower back on the left side. Allow a little bit of pressure onto your hands so you can gauge how much pressure you put into your hips. And it doesn't matter how flexible or inflexible you feel, work to your edge, listen to your breath, and breathe nice and steady as you hold in the classic lunge position. All right, very good. So now go ahead and release, take your left leg back. And now we're going to try a child's pose. Point your toes, bend the knees. If you need, come down on your elbows, come down on your forearms, and then just walk your elbows back towards your knees and see how far are you able to bend your knees. If you're able to bend your knees all the way and bring your hips down onto your heels, let your arms relax where they're comfortable and bring your head down onto the floor. If you have challenge in your knees that doesn't enable for you to go that far into the bend, keep your body weight forward on your elbows, and then just monitor and only apply as much pressure as feels good in your knees and in your lower back. And then take a few deep breaths as you hold in this pose to expand and open up the entire posterior chain of musculature on your back. You have a whole line of muscles that go all the way from down here in your sacrum up along the spinal column that come all the way up into the back of the neck, called the erector spinae muscles. When you relax your body forward, allow for these muscles to expand. And now when you breathe in through your nose deep, try to really balloon the rib cage area so it feels like all these muscles are releasing. And as you exhale, allow your body to relax. Good. Okay, next up, we're going to go ahead and come up onto the hands and knees. And now I'd like for you to try lying down onto your back. And we're going to do a classic position called the thread the needle. Now, if you need, I'm going to move my knee cushion out of the way. But if you need to use a blanket for a pillow, you can always set that up so that when you lay on your back, you'll have a little cushion under the back of your neck. This is completely optional, but I just like to point out some of these variations that you can use. Okay, so now bend your both knees and take your right foot, cross it over your left leg, place your right hand on your right knee, and first test the pliability of your right hip as we create external rotation of the thigh. So you gently press and see how your knee feels. If everything's going good, try to lift your left foot. This might be tricky. And so one thing we can do sometimes when trying to grab the knee is I can employ a strap, and I can take the strap and I can hook it behind my leg, and I can use a little bit of my arm strength to try to help me pull the leg up. That's one option. If you have enough flexibility to do so, take your right arm, weave it through the little gap behind the back of the leg, and grab your left knee and draw downward and loosen into your right hip. And this does a great job of, we externally rotate, and now we're creating flexion in the hip joint. So it opens up all the deep six lateral rotator muscles in your hip. And as you draw down, just continue to breathe. This is key, because stretching and opening the body and releasing tension of the body requires for us to get the nervous system to downgrade a bit, in the sense of we want to just calm the nerves. And one way we can do this is through our breath. And you just breathe, inhale and exhale through your nose. Try and maintain a nice, steady, easy breath rhythm. And we're now going to change to the other side. Go ahead and release and lower your left foot down, uncross your right leg and put your right foot on the floor. Take your left leg, cross it in front of the right knee, and then test by press your left knee away from you. Feel the sensation in your hip. We're working the external rotation of the hip, and we're preparing for flexion, which is going to go deep into releasing the back and the muscles that are key in the glutes and the hips. So what we now try is lift your right foot, reach your left hand through, try grab a hold of the right knee. You can use both hands and pull or draw the left thigh down towards your chest, and just relax all those muscles in your back and in your hip. And remember to focus on your breath. Inhale and exhale, breathe through your nose. As you draw the right knee down against the pressure of your left foot, release and relax any tension, and just go slow and steady. If it hurts, come out of the pose, and we got to investigate and figure out what level can we take the pose to where we can relax and breathe. So if you're new to this and you're just learning, remember that you're not trying to compete in your yoga. What you're doing is we can use yoga as a way of building concentration and becoming aware of the nervous system and learning the ability to release and calm the nervous system, dropping from the sympathetic nervous system, from the fight or flight mode into the parasympathetic, where we can rest and repair. Continue to draw down, and then we're going to go ahead and release. And we'll come into our final resting position, in which case, if you have a bolster, you can set it up underneath your knees and just let your legs come down and relax. If you have the low back pain, it can be a really good idea to elevate the knees. And if you find that the bolster or cushion is not high enough, here I'm just going to turn it on its side and make it just feel like it's a little higher. This one isn't balanced super well, so I'm just trying to find the sweet spot. And just let your arms relax beside your body, your palms face up, and take your attention to your breath. Close your eyes and breathe deeply through your nose. So when you inhale, breathe, expand your lungs. And as you exhale, breathe, allow all the air out. And remain here in this pose while I give you a little bit of further instruction as we close our practice session together. Take your awareness and attention down to your feet and relax your whole body from your feet up to your knees, to your hips, around your lower back, your middle back, your upper back. Relax your belly, relax your heart, relax across your shoulders. Soften your jaw all the way down your arms, to your elbows, to your hands, to your fingertips. Relax. And make sure, again, soften your jaw. Just try to relax your whole face, around your eyes, your nose, mouth, ears, all the way up to the top of your head. This concludes our 15-minute yoga for low back pain practice. I hope you enjoy. Remember to hit the subscribe button if you're on YouTube, and send me a question or a message, and I'll happily answer any questions you have. Remember to check us out on our website, nativeyogacenter.com. And I have lots of links there. Free yoga course, lots of links you can check out. Have a wonderful day. Enjoy. Namaste.